You don't have to worry or get into the panic state when you hear your doctor saying that you have been diagnosed with a tuberculosis. Have you know? With all the latest advancement in the medicines, tuberculosis is now treatable and hence curable. I am Dr. Gopal Purohit at Heredity Biosciences, covering the how tuberculosis affected and treatment in the World Tuberculosis Day. Let's spread awareness. Majority of the peoples are hesitate of consulting their doctors, and some cannot even afford the basic course of treatment due to the financial or some other issues. We are aware of this fact that TB is being the ninth leading cause of death worldwide, and somewhere the credit goes to everyone who does not consult their doctors or complete the full meditations course. 21st March is being observed as World Tuberculosis Day all across the globe. Let us make us effort to put a full stop into the fatal disease. The day not only enlightened the peoples about the disease, but also tell them all these preventive measures uh, that they can take to keep themselves healthy. In various countries, the government provide the screening and free doses of medicines to all the peoples suffering from the tuberculosis. TB treatment is all government hospitals and recognized centers in free in India. Let's see how the TB is affected. Tuberculosis is an infectious bacterial disease caused by microbacterium bacteria, which majorly affected the lungs of a person. It is contagious as it affected transmitted from the infected persons to a healthy persons via droplets from the throats and lungs of people with the diseases. World Tuberculosis Day was primarily observed in the year of 1882 by Dr. Robert Koch, who detected the cause of tuberculosis, the TB bacillus. He took the first steps towards diagnosis and curing the tuberculosis. According to the WHO guidelines, the year 2005 holds the record of the large number of new TB cases all across the Southeast Asia, which was accountable for 34% of incidents causes worldwide. In the year 2002-2015, 49 millions of lives were saved the TB through effective diagnosis and treatments. Now, let us talk about the impact of tuberculosis in India. In the year 2016 reports, nearly about 10.4 million new cases of TB get registered worldwide. 7 countries were majorly accountable for 64% of total burden of the disease, where India is accountable for maximum number of TB patients. The other 6 countries like Indonesia, China, Philippines, Pakistan, Nigeria, and South Africa also. According to the global report published by WHO in the year 2017, India still continue to have the highest number of tuberculosis cases in the world, with the estimated of 27.9 lakhs patients live with TB, and up to 4.23 lakhs patients have died during the year. If the tuberculosis happen, what are the symptoms of patients? Like coughing, sometimes with mucus or blood and chills, fatigue, fever, loss of weight, loss of appetite, night sweats. Now we will discuss about what are the preventive measure of prevention of this disease. Presently, the BCG vaccines like Bacilli, Calmette, Guerin is the only live and licensed vaccines present against TB in the world and has been in the use since 1921. This vaccine is prepared from a strain of weakened bovine tuberculosis bacillus, Mycobacterium bovis. The vaccine is 80% effective in the prevention of TB and more effective against the complex from the TB in kids. You should consult your doctors before starting your medicines. Now, we will discuss about what are the early diagnosis of this disease. So, if a treatment in this most usual way in the prevention process of tuberculosis in early diagnosis. After the 2 week of medicines, the majority of patients don't remain infectious. We will discuss how we managing our environments. Tuberculosis is an airborne disease. Hence, it is very important to keep our surrounding clean. The risk of the infections can be reduced by some of the following steps to be managed. By keeping the good vaccinations. Natural resources of light as UV lights a kill of TB bacteria. Maintaining good hygienic such as covering mouth while coughing and sneezing will reduce the spread of TB bacteria. World Tuberculosis Day is an opportunity to organize political as well as social commitment for future progresses by eliminating TB as a public health disorder. Every year, nearly 9 millions of people are diagnosed with a tuberculosis and approximately 3 millions of them doesn't get the care they needed. It is a high times now that we should think about the alarming situations and considering consulting the doctors is make sure the timely diagnosed and treatments and make our communities to be free. Yes, we can end TB. Thanks for listening. World TB Day. Thanks.